So are you having any physical symptoms or health concerns, like maybe headaches or stomach aches or anything like that?
Yeah, I have. In the past couple of months, I've been experiencing maybe more headaches more frequently. I thought it was kind of due to the weather. Sometimes I get pressure headaches.
Right.
But I guess with the stress of, talking about maybe changing jobs or moving has kind of caused me to have a little bit more headaches. And even, you mentioned, the stomach. I mean, my stomach has been kind of a little upset. I guess the nerves aspects
Right.
of it. And also my sleep patterns have been changed a little bit, I guess.
You want to tell me a little bit about your sleep?
Sure. Typically on an average night, I get between 5 and 6 hours worth of sleep. I typically get up between 3 and 3:30 to go.
Early riser.
Yeah. We have 2 kids, and so I like to get up a little early so I can go to the gym.
Okay, that's good.
It's a good stress reliever for me. My job is kind of stressful. And so I try to get up and go to the gym and get back home before they wake up so I can read my Bible and just have some time to prepare for the day. So.
Yes, that's always good. Now you said that you were having some sleep difficulties. Is 5 to 6 hours what you normally get, or are you getting less, or?
I guess that's probably about the normal, but maybe it just seems like it's not as restful.
Okay.
I guess I toss and turn a little bit more. Just.
Are you having any dreams or?
If I do, I don't remember them. I've always, even when I was a kid, I dreamt, but I just would never remember my dreams unless they were like nightmares or whatnot.
Right. And you're not having those.
I'm not having those. No.
Okay. So just kind of a poor quality of sleep.
Yeah. A little bit more. I guess, I don't know if it's typical, but I feel fine at the beginning of the week, but towards later on in the week, I just
start wearing down a little bit.
Oh, yeah.
Would you say it's better on the weekends, or?
A little. We do sleep in a little bit, or we try to sleep in on Saturdays, and sometimes we are able to sleep in a little bit on Sundays, depending on what's going on.
Okay. You mentioned that you do get up and exercise. So how often do you think you do that per week?
I try to do it between 4 and 5 days a week.
Okay, that's good.
I just started a new exercise routine. And I work out about 3 or 4 days, and I take a day off, and then I do another little cycle of 3 or 4 days, and I take a day off. So.
I hear that's good for your muscles, something.
Yeah,
like
it's
that.
good.
Yeah. What about your appetite or eating habits? Have you noticed a difference in that? Like, are you eating more? Are you eating less?
Not really. I haven't noticed anything. I haven't noticed I haven't been eating more or less. With this new exercise, I've been trying to eat smaller portions and more frequently, like more like 2 to 3 hours, just for diet or whatever.
All right, that's good. Have you experienced any significant weight changes, like loss or gain, in the past 2 months that wouldn't necessarily be contributed to your?
No, I'll always fluctuate between 170 and 175.
Okay, so nothing real significant.
Nothing is significant, no.
Okay. Do you regularly consume alcohol?
No, I don't drink.
You don't drink. Okay. Let's see. Have you ever engaged in recreational drug use?
I do not.
Do you smoke cigarettes or other tobacco products? No. Okay. I'm going to go in a little bit further.
Okay.
I know you've been saying that you have a little bit of anxiety going on, but have you ever had any suicidal thoughts?
I haven't.
And you said you were married.
I am.
Okay. How long have you been in a relationship?
We've been married for, my wife's gonna kill me.
It's a good thing she's not here, I guess.
Yeah. 6 years?
6 years, that's good.
We have 2 small children.
Okay. 2 children. So on a scale of 1 to 10, how would you rate your relationship with your wife?
One being bad,
One
and
being
10 being good.
yes, one being bad, 10 being good.
I would say 10.
Good.
Excuse me.
I know that you said that you are anticipating a move, but maybe think back for the last year. Has there been any significant life changes or stressors that you can really pinpoint?
Yeah, two big. Excuse me, I'm sorry. Two big things have happened actually in our life. We had our second child. He'll be 1 in May, so that's kind of a big life changing event. And then I got a promotion this time last year, and so I got the promotion in April, and then we had our child in May. And so two
very big,
yeah.
Yes, very big events right back to back.
Right.
Yes. How was your anxiety in that point in your life?
With having our second child, our son, it wasn't as bad because I was prepared with our daughter, but with the transition of one position to a newer position with more responsibility, it was a little overwhelming. I didn't get trained as properly as I thought, and so I felt like I was just kind of thrown in there to sink or swim, and so I'm a fast learner and I adapt pretty well, so I think I adapted pretty good, but didn't really understand or really anticipate the stress of the new job. So.
Right, so you would say that your job is kind of maybe your source of anxiety at that point?
I think so, because when I switched to this position, like I said, I had more responsibilities, and within a few months, within the new position, I had my first panic attack. It was not really work related, but it was a conflict with a co-worker, and so.
Yes, it was still in the realm of
that
your
work.
job.
Yes, exactly.
Have you had any more panic attacks?
I haven't.
Just the one? And that was about a year ago, you said?
It's coming up on a year, so it was like about 2 or 3 months after I got to my new position.
Okay.
So.
Okay, so that would be a yes on the panic attacks.
Yes.
I'm going to ask you about a few more things.
Sure.
Have you ever experienced any of the following? Extreme depressed mood? Dramatic mood swings?
I don't think so.
Rapid speech?
I'm kind of a I'm kind of a fast talker anyway, but I wouldn't. I don't know if you.
It's okay.
That right there might have been.
So, would you say that your anxiety is extreme anxiety?
I wouldn't
experience
say
that?
so.
No.
Because it doesn't really affect my day-to-day.
Okay, it's
activity.
just there.
It's just there. So.
Okay. What about phobias?
I'm afraid of snakes.
Is it
It's
afraid
not
or to a phobia level?
No, I wouldn't say. It doesn't affect my life.
Okay.
So,
Okay. And you said you have been having sleep disturbances, hallucinations, unexplained losses of time.
No.
Okay. Unexplained memory lapses. No. And you said you did not use alcohol. Frequent body complaints.
No.
Just some headaches. Sometimes.
Just the headaches.
Stomach aches.
Yeah. Or just unsettled stomach. So yeah.
Eating disorders.
No.
Body image problems.
No.
Repetitive thoughts like obsessions, like continually thinking about one thing over and over and over.
No.
Okay. About repetitive behaviors like frequently checking make sure your door is locked or frequently washing your hands, things like that.
No.
Have you had any homicidal thoughts?
No.
And you said you have not had any suicidal.
Mm-hmm.
Okay. All right, so we're going to talk about your work a little bit.
Okay.
No, we've kind of talked about it a little bit. We're going to go a little bit more detail if that's okay with you.
Sure, definitely.
So you are currently employed.
I am.
If yes, where do you work?
I work at actually a state facility.
Okay.
It's in the psychology field.
Okay.
And so I'm considered a behavioral health specialist. And so
Okay.
we deal with individuals with intellectual disabilities. And so
Okay,
not really
so-
counseling, but
In the realm.
in the realm. Yeah.
Right.
Yeah.
So I would imagine that would still be a little bit more stressful because you are taking care of other people.
Right, we take care of other people. We're responsible for like training. We're responsible for like implementing like different behaviors or programs and things like
Okay.
that.
So would you say you are currently happy in your job?
No.
No. And can we talk about the work-related stressors a little bit?
Yeah, sure.
So what are some things about the job that you are unhappy about, things that you feel like might stress that, trigger that stress?
I think ultimately, it really is like the people that I work with. Like,
Coworkers.
for the most part, I enjoy doing what I do. I enjoy my clients. I enjoy the I enjoy the atmosphere, but we're kind of understaffed, and a lot of people don't pull their own weight, and so the responsibility falls on just a few of us to pick up the slack, and so it's just really frustrating, and just I'm not able to do what I need to do as far as my responsibilities because of other people won't help out.
So you kind of feel like that a lot of responsibility has been dropped on you because you are understaffed and maybe other people aren't doing what they need to do.
Exactly.
And that's, you're kind of taking that home with you as well.
Right.
Okay. Is there anything else or is it really just this understaffed coworker thing?
For the most part, it's just kind of the understaffed coworkers.
Right.
And we do have new leadership. That's kind of a little stressful as well.
Right. And you've only been in this position for, you said, like a year.
For about a year, yeah.
So there's been a lot of changes since when you
There
started.
has been. One of our leaders retired. Then the responsibility went to kind of the second in command assistant.
Okay.
Then that person left, and so now we have two new leaderships that served in these positions before, and so it's just they're getting their feet wet,
Right.
And so.
But you kind of feel like you're in the I'm not gonna say war zone, but where you feel like you're getting the brunt of.
Yeah,
Yes.
exactly. Yes, I feel like, yeah.
Okay. That can be stressful. Is it okay if we talk about your religious and spiritual information for a minute? Okay. Would you consider yourself a religious person?
Yes.
Yes. If yes, what is your faith?
I'm Southern Baptist.
Southern Baptist. Okay.
I'm actually a Southern Baptist minister.
Okay. And so, you would say that your beliefs just kind of, like dictate, but like guide you along in what
Definitely,
you do.
yes. Like my belief in the Lord is my foundation to my life, to the way I manage my marriage, to manage my children, and is actually, since I am a minister, that actually leads to the direction of my changing jobs and positions, going from the position that I'm in now to possibly a church staff position. So
Okay, so you're...
That's the anxiety of change.
Gotcha. So you feel like you're going to be going from one thing to a completely different thing. Now, you said you are a minister, so have you been in this role before?
I have been in a ministry role before. I was a youth minister for 4 years prior to getting the job that I'm in now. And that in itself is a big change, just going from church work to secular work, that was a culture shock for me. And then kind of going from the secular work back to the church work in the anticipation of, am I making the right decision? You know, picking up my family and going to a different state, you know, am I, you know, as long as my desire, my goal is to be obedient to the Lord. And also, you know, the little anxiety of the first church that I was in for 4 years. There were some difficulties that arose with that church. There were some conflicts there. There was some miscommunication with leadership, and so I guess there's the anxiety of, you know, I don't want that to happen in this new church. I mean, it is a different position. It's I was a youth minister, and now I'm going to children, so
it's a change.
It's a change, and so there's that anxiety.
You have a little bit of hesitancy because of what happened in the past.
Yes, exactly.
And that's adding on to the anxiety of the moving and the changing of jobs because of your past experience.
Right.
It's a little bit more.
And there is excitement there as well.
Right. Okay. Now, we're going to talk a little bit about your family mental health history. If you know the answers to these, do you have a family history of depression?
My mom, when I was younger, like elementary school or high school, she was diagnosed with mild depression.
Okay.
And she did go see professional help, and she took some psychotropic medicines.
Okay.
And my dad just actually recently went and talked to a professional about anxiety.
Okay, so anxiety with your dad. What about bipolar disorder? No. Panic attacks in the family?
My mom used to have panic attacks.
Okay. And those, were they mild, or do you know?
The ones that I used to see, they were pretty severe. She would cry. She would just be in a panic. You know,
right. So. Schizophrenia?
No.
No. Alcohol or substance abuse? No. Eating disorders? Learning disabilities?
No.
Trauma history? Suicide attempts? Or chronic illnesses?
No.
Okay. All right, so I have a couple more questions.
Okay.
And what about you? Let's talk about you for a minute. Do you have any strengths that you would call strength you see in yourself?
I'm a pretty organized person. I kind of take pride in that I'm kind of an organized person. I like things to be kind of in a specific order, not to the point of like
You're not obsessed
autistic
with it,
or like this with it.
Okay.
Exactly. And so
good
I'm a fast learner, and I enjoy learning. And I feel like I have a good strength in as far as like people skills, relationship building, and so
you're good with people. Okay. What do you think is your best attribute, or what do you like best about yourself?
I guess the one thing that I really, like about myself is the fact that I am a kind of caring and compassionate person, and I'm willing to serve. And I guess that's kind of goes back to the frustration of that I feel like I'm getting taken advantage of, because I do enjoy serving. I do enjoy being with people, but I feel like I'm being taken advantage of.
Yes, like you feel like they know that you enjoy that, so
they're not. I'm not going to say no. So
right.
Yeah.
And you feel frustrated.
Yeah, definitely.
Do you have any effective coping strategies that you have learned, things that you use when the anxiety comes that will help you calm down maybe?
Sometimes what I'll do is like I'll take a moment, I'll pray.
Okay.
I remove myself from situations because the more I'm in the situation or around those certain people, the more I continue to let those feelings kind of stir up. So I try to remove myself from those situations. I like to sing, so I'll sing or I'll pray. And then I have other coworkers that I kind of talk to that I can
That's
talk
good.
to. So yeah.
So, as we enter this therapy relationship, do you have any goals that you would like to work on?
I guess one goal is to be really not to let things just consume me to the point of having these anxiety thoughts. I guess more like manageable, manage my thought patterns, not letting stuff kind of just pile up on me, on my shoulders, kind of releasing some of the stress of it, not to let things bother me as much.
And that's definitely a goal I feel we can work on. Just learning different coping strategies, maybe. You have several good ones that you are already implementing, but maybe we can learn some more that are more effective. Just getting the anxiety down, maybe trying to even pinpoint further, maybe where it's coming from.
Yeah.
I know it seems like it's work related and change related. Maybe we can dive into that a little deeper if you would like to continue sessions.
That sounds great. Yeah,
Okay.
definitely.
All right, well, if you want to continue, I will look over everything and we'll give you a call back.
Thank you. Awesome. Thank you so much. Nice to meet you.
Nice to meet you.